Greetings, Mrs. A. I'm Dr. Dinesh here. I'm the medical resident in charge of your mom. It must been a very difficult day for you and your family. I do understand. My intention here is to make the family to know what has happened to your mom and for us to have a better understanding of what can be done and what has been done. If throughout this conversation you do have any queries, please do ask and I'll try my best to explain to you. Yes, Mrs. A, as you mentioned, she had an episode of seizure. So in Malay, seizure, we call it as sawan. Your mom was admitted because of a condition called as fluid overload, or in simple terms, too much of water in the body. So the treatment for it is we usually opt for oral or intravenous medications to flush off the water. When this fails, there's a role for dialysis. So that's why your mom was put on dialysis. It's very unfortunate that she had to go through this episode of seizure. But once it occurred, we managed to identify, we stopped the dialysis immediately and we gave her some calcium and she recovered, and we managed to protect her airway, and currently she's comfortable, she's under room air, she's in but we are we are keeping close monitoring her in the acute cubicle because we want to give the best for her. That's a very fair question, Mrs. A. I would like to just explain to you in brief what hemodialysis actually does. Number one, it helps the kidney to remove the toxics that's been produced, and in some cases, like your mom, it helps to remove the excess water that has been formed in the body. So during this process, there is tendency for the electrolytes, or to understand easily, probably we can think of it as salts, garam. So there is shift of the salts in the body, and this causes some issues, like in your mom's case, the low level of calcium, hypocalcemia we call it. This can be part of a complication of hemodialysis we don't routinely encounter, but in your mom's case we have encountered and we have acted very fast on it, and we have stopped the dialysis and we gave her calcium. She's improving, we are monitoring her. I think that's a good thing, but our team is looking at the bloods again. We are thinking, we are re-evaluating, is there any other possibility that we could have prevented this. It must felt very hard on you guys. I understand, we understand. As from the team, which comprises of the nephrologists, the HD nurses, the doctors, myself, the medical assistant, and who not, we are very much concerned of what happened, and we are trying our best to prevent what has happened, and we are looking into things of how to make it better. Yes, currently she is stable. She's in the acute cubicle. We are keeping a close eye. We are keeping a close monitoring on her. She is under room air. We don't see reason to be worried currently. And for her future HD, we have consulted the nephrologist. The nephrologist will be reviewing her shortly, in another half an hour or so. And for now, we are planning for what we call as a gentle HD. We don't want to stress her too much, and we are keeping a very close eye on her calcium levels, on her electrolytes. We would not want her to experience the same thing again, and her safety is our priority. So I think we can say for now she is safe. Yes, the feeling is mutual. Your mom's safety is our priority. All our patients' safety is our priority. So, we are sorry for what has happened, but we are taking steps to prevent what has happened, and we want to do the best. And the best means to make sure that your mom is safe and we do things in a safe way. Yes, that's about it. Thank you, Mrs. A. Have a nice day. All right. Keep your mom in your prayers. I'll keep her in mind too. Take care.